Welcome back in. Flu season isn't just about coughs and fever. It can also put serious strain on your heart. Joining us now is Dr. Imad Hariri to explain why doctors are especially concerned during severe flu season and what warning signs you shouldn't ignore. Thanks for being here today.
Thanks for having me.
Absolutely. So, yeah, a lot of people are coming down with the flu right now. What are the concerns there? What can it do to your heart?
What we're talking about is the influenza infection, not just a common cold. Usually, patients with influenza get an activation of their immune system that tries to fight the whole body. And when that happens, puts a lot of stress on the heart. And all of a sudden, the heart's having to work harder to pump out more blood. You get things like fever and dehydration that make things worse for patients. So they tend to get less blood flow to their heart and other organs, making things worse. When people have influenza, even patients with no heart disease, it can affect their heart function, make them susceptible to having complications from the flu also.
Okay, so this could be an otherwise healthy person may start to suddenly feel some issues here.
Yeah, it's not uncommon for patients who have no previous health history to actually get infected with the influenza virus and get something called myocarditis, or inflammation of the heart muscle that can weaken the heart muscle, make it harder for the heart to pump blood out. And patients develop symptoms of congestive heart failure, unfortunately sometimes leading to either heart transplantation or, in rare cases, death also.
So are there folks who are maybe at a greater risk, though?
Typically, just like any other infection, we say patients over the age of 65, those with chronic conditions like diabetes, heart disease, coronary disease, lung disease are more susceptible. Patients I see usually have congestive heart failure, and those patients are especially vulnerable because they tend to get more fluid overload symptoms that overwhelms their heart. And we try to make special treatment plans specifically for when they get sick so they know what to do during sickness.
Okay, so what are some of the symptoms that you might want to particularly pay attention to that you might say, maybe it's time to go to the ER or to the doctor?
Most people get this upper respiratory-like symptoms, but the symptoms we're really telling people to watch for are shortness of breath, symptoms of pneumonia, chest pain, heaviness on the chest. One of the ones that we sometimes see people start getting fainting spells or palpitations. I think that's when people start feeling like it's more than just a regular cold. It's wise to seek more immediate medical attention for it.
And maybe something that they haven't felt before.
Absolutely.
Especially with influenza. Yep. So is there something we could do to prevent these complications?
Yeah, I think first of all, follow the basic precautions and hand washing, staying, at home when you're sick. But the most best way to prevent this is a flu vaccine yearly, especially in people who are vulnerable. And taking care of your existing health conditions, making sure your blood pressure is under control, your diabetes is under control, and seeking care in a timely way when the symptoms start to get worse.
Is it too late for people to get a flu shot now? I feel like we're like, winter's almost over, right?
No, absolutely not. I think flu vaccine anytime during the flu season has been shown to prevent from serious complications from the flu, and that's what we're trying to have people prevent.
Okay, so what's a big takeaway that you want people to know? They might say, okay, well, I get the flu every year, and what's the biggest takeaway?
I think that people understand that the flu is not the common cold. It can lead to serious complications, especially in at-risk patients. Know that the flu is preventable, especially complications from the flu are preventable by taking a vaccine every year and seeking care and not just riding through it, and making sure people rest and hydrate and make sure they take care of themselves.
Yes, I know you want to be on the go, go, go all the time. And people might just think, oh, it's just a cold. It's just but when you've got the fever and the body aches, and that might differentiate itself a little bit.
Especially when people start developing pneumonia and other things like that.
Right. So, all right, folks, take care of yourself, right? I know. Thanks so much for being here today. We appreciate it. Yep.